Hi, this is Christian J. Pukay. Today I'm going to talk about borderline personality disorder. It is one of the disorder that is under personality disorder. First, I'm going to give a brief discussion about personality disorder. Personality disorder is a group of mental conditions which have an unhealthy pattern of thinking, feelings, and behaving. A person with personality disorder have difficulty relating to other people and everyday situations in life that could result unstable relationships, difficulty in social encounters, and work settings. There are three types of personality disorder that are categorized into clusters. Cluster A has characteristics of eccentric behaviors or thinking like social isolation and detachment. It may also exhibit distortions, excessive suspiciousness, and cognitive impairment. These are paranoid, schizoid, and schizotypal personality disorder. Cluster B is characterized by being overly emotional, dramatic, and erratic behavior. Most people with cluster B type of personality disorder have problems with impulse control that may resort to behaviors that are considered desperate to make ends meet. That includes manipulating other people, acting out, and committing antisocial acts. The following belongs to cluster B personality disorder: borderline personality disorder, narcissistic, histrionic, and antisocial personality disorder. Meanwhile, cluster C types of personality disorder exhibits anxiety, hypersensitivity, fearful thinking, and relationship dependency. These are avoidant, dependent, and obsessive compulsive personality disorder. In my case study, I will focus on borderline personality disorder, which belongs to cluster B type of personality disorder. Borderline personality disorder is an illness marked by an ongoing pattern of varying moods, self-image, and behavior. There are four major characteristics of borderline personality disorder, or BPD. First is the unstable interpersonal relationships. Second is dangerous impulsivity that may result in self-harm. Third is mood instability with chronic feeling of emptiness and intense anger. And last is an unstable self-image and sense of self. Factors that contribute to borderline personality disorder is not clear, but research suggests that genetics, brain function, and environmental factors affect the disorder. So patients with family who have history of borderline personality disorder is high risk of developing the disease. Another factor is that the brain function of the borderline personality disorder patients have structural and functional changes in the areas of your brain that controls impulses and emotional regulation. And lastly, environmental factors also contribute to the disorder. That includes cultural and social factors. Most patients with BPD had experienced traumatic events such as abuse, abandonment, exposed to unstable relationship, and hostile conflicts. Now I'm going to talk about the anatomy and physiology of borderline personality disorder. A person with BPD has altered functioning of serotonin in the brain. The 5-HTT, which is the serotonin transporter genes, may have shorter allele in patients with borderline personality disorder. It has been associated with depression, aggression, and impulsivity. On the other hand, Norepinephrine and dopamine, which are the neurotransmitters that act as constraints in the brain, is also under function in BPD. Moreover, a person with BPD exhibits low volume or size of the amygdala and hippocampus that may also aid with the disorder. Hippocampus plays a significant role in changing short-term memory into long-term memory, while amygdala integrates emotions, emotional behavior, and motivation. In addition, prefrontal cortex also plays a role in patients with borderline personality disorder. The main function of the prefrontal cortex is to regulate emotions, restrain from inappropriate function, supports reality testing, and guides attention and thought. Now, it has seen in magnetic resonance imaging that when a person who has BPD is exposed to negative emotional stimulation, there is less activity in the prefrontal cortex. However, in left amygdala, left hippocampus, and posterior ungulate cortex, there is heightened activation during processing of negative emotional stimuli. During anger induction, weaker activity occurs in individuals with BPD. Anger induction usually causes increased activity in the left inferior frontal cortex. So as you can see, there are abnormalities in the brain function of a person with borderline personality disorder that contributes to the disease. Now, I have a patient profile here who is diagnosed with borderline personality disorder. A patient's name is Melba Trasona, a 30 years old female patient who was admitted 2 months ago in the mental health hospital in Saskatoon. Ms. Trasona is a Filipino who migrated to Canada a few years ago. She currently lives in an apartment in Saskatoon with her 2 daughters. The patient was diagnosed with sudden worsening of borderline personality disorder. Aside from her mental disorder, the patient has chronic diabetes, hypertension, anxiety, and depression. She was divorced twice with 2 children from her first husband and had an abusive relationship with both of her ex-partners. Ms. Trasona also had history of attempting suicide 3 times at home. Before she was admitted, she was found by her 12-year-old daughter in the bathroom slashing her wrist with a blade. Her 14-year-old eldest daughter described her mom as having an impulsive behavior, especially when she is upset and angry. Patient also has no stable job. She also has lack of support because she was recently divorced, has relatives in Calgary but no constant communication. She had poor relationships with her daughter. And she is not affiliated to any group or organization. So for patients with BPD, there are many therapeutic techniques that can be used. But I just chose 2, which is very significant to my patient's profile. Statements like you mentioned that you have difficulty maintaining relationship with your ex-partner and your children. Can you tell me more about it? It is an exploring therapeutic techniques. It is very good for my patient because it will motivate her to share more about her situations. Another significant therapeutic techniques also that would fit into my patient is to identify results of impulsive behavior. Statements like, what do you think would be the consequence if you cut your wrist? So in this way, patient would be able to reflect and realize what are the consequences if she's gonna attempt to do suicide. So here is my nursing process. The nursing diagnosis that would fit into my patient is risk for self-mutilation related to history of suicide attempt. Treatment goal is patient will be free from self-inflicted injury. Intervention, encourage and assist patient to attend therapy sessions like cognitive behavioral therapy to help regulate unstable emotion. So I'm going to talk a little bit about cognitive behavioral therapy. It is a therapy that is usually used for patients with borderline personality disorder because it can help regulate emotions, tolerate distress or conflict, navigate relationships with other people, and achieve motivation to avoid unhealthy coping skills like self-harm. So my evaluation is that after 2 months of attending therapy sessions, patient was able to avoid suicide ideation and free from mutilation. Treatment outcome, Milba, my patient, is free from self-mutilation and harm. Another nursing diagnosis that would fit into my patient is an ineffective coping related to uncontrolled destructive behaviors. Treatment goal is that patient will be able to identify stressors that provoke impulsivity and able to set realistic goals on how to control destructive behaviors. Nursing intervention, assess knowledge and skills about adaptation to stress and assist patient in setting realistic goals to reduce uncontrolled negative behaviors. Evaluation, after 1 month of consistent meeting with the patient, she was able to have the confidence in controlling destructive behaviors. Treatment outcome, patient knows how to perceive major stressors and react to it in an acceptable manner. At present, there are no medications specifically approved for patients with BPD. When a patient is prescribed medication, the purpose is to help the symptoms. In my patient's case, naltrexone hydrochloride is usually prescribed to control self-injurious behavior. The generic name is the naltrexone, and it is an opioid antagonist. Important patient teaching before she would be discharged is that patient should be advised to carry medical identification stating that she is using naltrexone drugs. This is to help the emergency, in case of emergency, to let the healthcare provider know that she's been using naltrexone. Tell the patient also that these drugs may cause dizziness, so she must avoid driving or do anything that needs alertness until she is able to do it safely. She must also avoid alcohol or marijuana that might increase the tendency for dizziness. And she should consult pharmacist or physician if she's planning for breastfeeding. There are many community support services in Saskatoon, but what can I recommend is CFS Saskatoon, Canadian Mental Health Association in Saskatoon, Family Service Saskatoon. I will provide phone numbers and addresses of these community support services for my patient. Also, if in case my patient is experiencing crisis, she can call Saskatoon Crisis Intervention Service. It's a 24 hours crisis line, and I will provide also the number. Or she can also call Healthline 811. It's also available 24/7. It's confidential and free. And the best of it is that translation is available in over 100 languages. So in my patient's case, she is a Filipino and English is not her first language. So she has the option to call 811. So that's all for me about borderline personality disorder. Hopefully you learned something from my presentation. Thank you.